I think so.
I
I hope so too.
So let's talk about hypoglycemia. So type 2 diabetics rarely run into hypoglycemia. It's pretty rare. But type 1 diabetics, they take insulin and they exercise too much, or they don't eat enough or get enough carbohydrates, they'll go hypoglycemic. Also, what is type 1 generally referred to as the layman's term? As diabetes. Well, that took a lot of deep thought there.
I got you.
So we call type 2 adult diabetes. We call type 1
Child diabetes.
Jew.
You're a genius.
Juvenile, yes. Not Hall, but diabetes. Yes, juvenile diabetes. So why we call it juvenile diabetes is because it's more predominant in children. And kids have, if they don't have someone that's really training them and they're not completely on it, managing their insulin and their carbohydrate intake, they can easily become hypoglycemic from too much insulin, which will pull all the sugar out of the bloodstream and into the cells, and there's no sugar left in the bloodstream. So what do they look like? They look like the same as an adult hypoglycemic. It's not like shock. Even though it is insulin shock, it's not that kind of shock. They get lethargic. They turn very pale. They start profusely sweating, and their heart rate goes through the roof. Pediatric hypoglycemia. Any questions? All right, pediatric hyperglycemia is usually from undiagnosed DKA or DKA with a child and the parents are not managing it properly. Symptoms will include increased thirst, urination, flesh skin, a fruity smell on the breath, a slow onset over a few days. Any questions? Yes.
So I'm sure you smelled it before. How fruity is it? Like, is it?
I wouldn't say it smells like fruit personally. To me, no, to me it smells more like nail polish
Oh.
or nail polish remover. If you know what acetone smells like, it smells to me more like acetone.
I do that.
Does it smell like sweet pea, Caleb?
Smells like pee.
Ew.
Straight pee.
Like urine?
Like the ones that I've encountered, pee. I don't know if like the pee just bats it, but it smells like pee.
That's gross.
It smells like pee.
So it smells like urine. There you go. I think it smells more like acetone.
I guess it's
Then
up for
urine.
interpretation.
And if you don't have diabetes, it smells like a sumo wrestler trying to slow second base, which would be you're out. It smelled you. I said it's reaching. It's reaching really hard for that.
Yeah.
What the mental
Those sumo wrestlers stealing second base, even I can throw that out. Any questions about hyperglycemia? All right, conclusion usually comes from what head trauma. Wait, no, that's concussion. Sorry. Airway and ventilation. Aggressive airway and ventilation management. Aggressive airway and ventilation management. But wait, if you act now, it's still aggressive airway and ventilation. Any questions? Kids do wear themselves out because they don't have glucose storage. They do become hypoglycemic when they're in severe respiratory distress because they burn up all their glucose working the diaphragm up and down, even if they don't have a diabetic condition. Any questions? That's actually a pretty real picture. That kid looks like a cardiac kid. The cardiac kids have trouble managing temperature. Healthy children and healthy adults manage temperature easily. They vasodilate, vasoconstrict based on if they need to warm or cool themselves. Cardiac kids don't have that ability, especially if they have a malformation or it's called a congenital heart defect. And so that's a very common thing when they get overheated. They turn completely beet red, but they actually enjoy having an ice pack pushed on their face. A lot of kids will stick their head in the freezer, or they'll stick their face in the fan, just trying to displace that heat. So we're going to go over the difference between shock and hypotension, and a compensated, decompensated shock, and how to appropriately manage it. What is shock? Inadequate perfusion to the distal cells. Cells in the body. Hypotension is low blood pressure. So hypotension does not automatically mean shock. Any questions? There's the difference between compensated and decompensated shock in a child. Most kids now use LCD screens. They don't use CRT anymore. That's a really bad joke. CRT is for cathode ray full time, not cathode ray tube. Most of you probably don't even know what a CRT monitor even is. We've all grown up with LCDs and LEDs. Dum dum ding. We have 2 slides, 2 seconds. You're welcome. So how'd you get here? How'd you get here?
I'm driving my Jeep.
Oh, there you go. Cool. Very cool. So the markings on bear, it's the same bear that Brooke hit. It's the same bear Brooke hit.
On free.
Yeah, I think he lies in wait.
I just fixed it off.
All right, management of shock. Do not elevate their feet, but keep warm.
Don't elevate their feet.
Now we found out they die faster.
Like in the photo there.
Yeah, I know it's an old photo. I haven't updated it. I haven't found a better one yet. Yeah, so we used to always elevate the feet, and then they actually started studying it. They found out when you elevate the feet, it raises the blood pressure, which is why we want to elevate the feet. And if they're bleeding to death, then they bleed to death faster because you just elevated the pressure. Yeah. Now, if it's shock that's not hemorrhagic shock, you can elevate the feet.
Like blood trauma.
Blood trauma, you should not elevate the feet. Because you're worried about bleeding. Yeah. All right. Let's see what y'all have learned. First of all, doorway impression, that's a sick kid. Sunken eyes, red around the eyes, looks listless. Yeah, it does. It looks like a Halloween child. So you got a 9-year-old, 9-month-old, not 9-year-old. It's got 3 days of vomiting and diarrhea. and poor oral intake. He says not been eating or drinking much. And I believe it. That kid, look at the rash of that kid too. That's a sick kid. Who are we gonna bring? What friend are we gonna bring with us to help us do the assessment? Pat, our old friend Pat. So airways open and maintainable, so that's good. Respirations are too high though. And heart rate's definitely too high. So 2 of the 3 parts of the triangle. We have a very, very sick child. Only weighs 8 kilograms. Huh? Yes.
Like 17.
Yeah. Yeah. So the compensated shock is what we're in here. This kid's not going to stay compensated if they don't get some type of treatment and fluid and rehydration. Next one. Does that kid look sick to you? The 15-month-old presents with 12 hours of fever and 1 hour of lethargy and a purple rash. No, it's actually Barney syndrome.
Is it?
Yeah, it's a purple dinosaur.
Yeah, well, I remember where that.
About Barney syndrome? It's a little bit better because the only one step below that is we get a Barney syndrome. That's to bring the kid with you. Exactly. Make sure they don't do a press conference. Uh-oh. Yeah, Pat says, dude, we got some issues. So respirations are 60 or 4 chest rise. That's a big flag. Capillary refill time 7 seconds. And they're unresponsive. Responding to pain, which means you gotta hurt them, you gotta do anything. All 3 sides of the triangle. We're in big, big, big trouble. What do? Scoop and run. Give ventilations. So one of that's a calcium channel blocker. How does your automaticity of your heart work to make the heart beat? Remember? Right. What causes it to create some electricity to polarize, depolarize things?
They don't do pacemaker.
Right, but what causes the pacemaker to work? Gotta have automaticity anyway. It's a potassium sodium pump or potassium calcium pump. So if you block the calcium, then the automaticity doesn't work. So the heart can't beat as hard as it beats home. It's taking a bottle of cyanidine. It's really, really bad. So we discussed with Pat. Pat says airways partially obstructed with a tongue, so we can mitigate that. Respiration of poor air entry and poor tidal volume. So you begin doing what immediately? Thank you. And the heart rate's 30 beats a minute. So what do we do if the heart rate's under 60? Ventilation for 30 seconds, and if it doesn't improve to 60, above 60, we do what? Ventilation, the heart rate improves to 70, but it still has a poor capillary refill time. Any questions? I guess that's it. That kid's gonna die. Unless you saved it. All right, 12-month-old child, kid's got congenital heart disease. Mom says he's been fussed the last 3 hours. He only weighs 22 pounds. The whole Pat noticed those patients got heart rate of above 220. Sorry,
Thanks.
what just happened? What? I think I fell asleep with my finger on the button. What? It's not there yet. Like day 22. Thank you. Wednesday's 24. You're right.
Yeah.
Wednesday's 24, Thursday's 25, Friday's 26. You're right. It's like across the international date line.
We should have told you.
Yeah, I would have been going. Yeah. I think I'm gonna make it with us. Let's stay on the beach and sleep. Wait for turtles to start biting my toes. Drink 151 and Coke. What? So sweet. All right. Cardiovascular compromise in kids. There's nothing you can do about tachycardia. You got to get them moving for advanced life support intercept. Yeah. They can give adenosine or they can shock them. They can light them up. All right, we got a 9-month-old with difficulty breathing and a fever. History of recent fever onset. There's no injury. So we go to see our old friend Pat, who says they have an abnormal work of breathing. That's not good. They have abnormal color. That's not good. That's not good. Breathe 80 breaths a minute. Heart rate's 180. How sick is this kid? Big sick. This is run to the ambulance with the kid. Yes. Triangle Doom.
I like that.
It's now everyone you know that's named Pat, you should call him. Hey, Triangle of Doom. Make sure you know the difference between respiratory distress, respiratory failure, and respiratory arrest. Actually, honestly, not acceptable false. All right. Causes of respiratory dysfunction. So remember, when you hear stridor, you should be thinking upper airway obstruction. When you hear wheezes, you should be thinking lower airway obstruction. And when you hear crackles in the lungs, you should be thinking of fluid in the lungs or respiratory disease of the lower airways. I'll be right back while you guys write all that down and memorize it. I'll be right back. Huh? Abandonment. It's not abandonment because I'm going to leave you at the Cape to land to Caleb.
No, that's even worse.
I'd rather just be left as.
You might fall asleep at 30 minutes later. We were with 30 slides back. Right, well, this is why he's sleeping. Exactly. That's my three kid and kid. No, I'm totally. I got Friday, Saturday, and Sunday. It's gonna feel glorious. I have like, I got a whole list of projects I'm gonna do. I gotta study, break down the stories of everything. Oh. First tough though, I got 2 more days. Here again.
Yeah, so I want to try to.
Would have been smart.
Me too.
10 years though.
What time?
10.
They only, when you call them, you talk to them.
I bitched about Brian. He called someone and then somebody called me. I got tired of getting this. Yeah, I didn't have time for that. Yeah, left messages, everything. And then when I finally did get something, they transferred me to the wrong part. If you do, walk into the ER and go right to the desk and tell them that you're a COS. Yep, and you'll get it, and it's right there, right there. I can't say no.
Yeah, it sounds like sounds like they don't want
How do you feel?
Just ask.
All right. Any questions on the physical anatomical causes of the symptoms of upper respiratory or respiratory airway issues in pediatrics? Let's talk about the common diseases that cause lower airway obstruction issues in infants and children. Asthma. Full body aspiration, which last I checked is not a disease. Bronchiolitis is though. Any questions? Yes.
Stay green, word set.
Asthma.
Asthma.
Yeah, I did that on purpose, just to make you work harder.
Yeah, thanks.
Want you to earn this.
He cost me a car, dude.
I cost you a car.
Yeah.
Have you gone over and talked to the people at the circus about their circus fair? It's over in Bel Air Park right now. Get a circus bear. It even had like one of those little Russian hats on. It even had one of them little Russian hats on. That's what I did. No, it's not. His name was Yogo, it was Boris.
I just wanted to be on the same level. That's all.
I think it was a Russian circus bear. His name was Boris.
It's definitely not that. Honestly, at full speed. Anyway. Thanks for the green.
Most Priuses would go underneath of it.
You would think.
They're aerodynamic, the bear would go over them.
I truly thought it was a big urban in the ground, so wait, it freaked me out.
I don't have time for those jokes on the side of the highway anymore.
I barely made it home. Sorry.
Side of the dead animal was more than you could bear.
Yeah.
Let Warren answer that. All right, any questions about bronchiolitis? I would start getting them towards advanced life support or a hospital. Albuterol, inhaled epinephrine, very helpful. Yeah, it would help. By that paramedic looks like a dinosaur. Any questions? All right, next question. How can you distinguish respiratory distress from respiratory failure? Anyone? Right, so you're not having English word. Smooth muscle tone. And Brady Bunch. See? Bradycardia, come on. Marcia. How many people here even know the Brady Bunch is? You guys like what know the Brady Bunch is? You don't know what emergency is? I got nothing. You got me.
Wait, isn't
I'm
emergency like
That was before
vitamin C
emergency.
supplement?
What's that?
Isn't emergency like a vitamin C supplement?
Nothing gets past you.
Now I
man.
really have no words.
It is.
You're right, but that's not what he's talking about.
You don't have Kazi at home? It's a TV station that plays all the ancient television shows, all the classics. Emergencies on Kazi. No. BTV? Oh, ME? That's another one. Yeah. That's the competitor for Kazi. Any questions? Nebulized albuterol, that's an ALS procedure, so get them moved towards ALS. That's how you keep them from going into respiratory failure. If these kids stay in respiratory stress long enough, they're gonna end up in respiratory failure. What is that? Bouncy ball. Kids love to choke on bouncy balls.
Wait, what? The texture just so nice.
Any questions? Pat says the airway is completely obstructed. A completely obstructed airway is not compatible with life, Pat says. All three fat triangle sides are positive. You need to get the ball out. So what do we do? Very good. You want to get as much air pressure inside the thoracic cavity to pop that ball straight out. Exactly. Any questions? All right. All right, so I know how many people looking at this picture see Matt Miller?
Short more.
Yeah. I mean, it's like identical. Yeah, I even sent a picture that one day from the T class. They were looking at pictures of you. It's like, oh my God, that does look like me. That's an ancient picture. So that's a Life Pack 5. That goes back to the days of emergency.
Yeah.
Yeah, that's a telemetry. Yeah, that's, Matt Mello was probably about 4 years old when that picture was taken. Yes,
So like at what age would you switch from doing back squats to abdominal thrust?
1 year old, 12 months. All right, so we've already been to the anatomical and site physiological differences. But we're gonna review it. Yeah, they got that big alien head and that little tiny anterior soft airway. It's a bad combination. Yeah. Yeah, the yes, very much so. Soft rib cage. Yeah, the engineers that designed the children did a horrible job.
It's also why my brother is like.
Yep. Especially cats.
Like mountain lions, which we have here.
But you wanna know something though? That makes me feel good that that's where your mind went, because that means that somebody's trained you well to watch out. That makes me feel good. No, you watch a lot of sci-fi. Yes. You were talking about mountain lions. She was thinking of media moguls and politicians. And tropical, yeah, it is. I'd like to go on record on the recording. I didn't kill myself. My name's not Jeffrey. Any questions on the differences? All right, so more of it. Thinner chest wall, the lung is actually more exposed to blunt trauma energy. Their blood pressure will not change. And there's that surface to mass ratio again. Any questions? Remember surface to mass ratio? If I crumple the piece of paper up and light with a lighter under it, as opposed to having it stretch out, hold the lighter, it burns up faster. Any questions? All right, let's see what you've learned. A 3-year-old has fallen out 20 feet from a 3rd-story window. Somebody wasn't doing a good job watching. We bring our friend Pat. Pat says this kid does not look well. They have obvious head trauma. They're tachypnic. They have retractions, and they are pale. So all 3 sides of Pat, which means this is a critically ill child. Yeah, they're bleeding out somewhere. They're bleeding inside, which we will call an occult bleed, which means you can't see it, but you know it's there. Yep. 40, how old's this kid? 30, yeah. I'm definitely concerned with the respiratory rate of 40. I'm definitely concerned with the heart rate of 190 with capillary refill time of 4 seconds. We got big issues. We need to load and go and notify the trauma center. The other problem is that pediatric trauma centers generally don't have pediatric tools to do surgery. Why? Because it's expensive to maintain and you never use them. Yeah, the closest pediatric trauma center to Siskiyou County is UC Davis in Sacramento. Yes. Oh yeah. Yeah, well, and if you ever know, they might do their chest decompressed. There is, they'll bleed to death to go somewhere else. You got 1 hour. There is. Your golden hour is still your golden hour. So if it's gonna take you an hour to get somewhere for the time that happened, it's pointless. So you're better to go get the bleeding stopped. And then if they need like a neurosurgeon or something that's a more definitive care, you stabilize them at the local trauma center to transfer them.
So you're not worried.
I never. Well, first of all, helicopters can't fly today. This is too far of a range. It's stopping fuel. The fixed wings take forever. It's faster to drive. It's like we flew a lady to San Francisco this morning. Like we told the husband, if you get in the car and leave right now, you'll beat us there. By the time we drive out to the airport, load her in the plane flies to San Francisco's airport, unloads, gets in the ambulance, drives to the hospital. So. No, there's just not enough time. It's a time sensitive injury. You send them to the closest trauma facility and then stop the bleeding and then get them sent to wherever they need to go for definitive care. Unless you can time, like I said, unless like the helicopter's flying over and there's a boating deputy that sees it happen and it lands on the shore, that's going to be the only time it's going to be fast enough. Or the helicopter's already here on the ground and you can go boom right in. Otherwise, I mean, just to get to this county, it takes 40 minutes to get a helicopter here. They can't get here and back in the golden hour. It's physically impossible. That's why you have your low level trauma centers to keep people from bleeding. And there's still about 2/3 of this county you're going to bleed to death. If you're in Salmon River or Happy Camp, it's over. All right. So they decided this kid's in decompensated shock because he fell 3 floors on the pavement. Probably ruptured his spleen and his liver. Probably has a pneumothorax. Yep, sure enough. Right scalp contusion, admin's distended, right femur's broken. Yeah, this is bad. Unequal pupils. Hope it wasn't a sibling that pushed him out the window. That happens.
Making it to say.
Huh?
Even if we got them to match us.
Uh-huh. If they can stop the bleeding, yes. If they can't stop the bleeding, no. And then how bad and how much damage there is. Generally, any trauma surgeon can go in and stop the bleeding. Again, if it's a ruptured aorta, it's not good. It's going to need a vascular surgeon. It's not good. But most of them can stop the bleeding. Any questions? This kid's got a lot of problems. Traumatic brain injury, ruptured internal organs, long bone fractures. They're real bad shit. So get some fluid going on this patient, gives them a little bit better color, but their pupil's still blown. Yeah, so there's you guys will have local protocols of traumatic brain injury and how much they want you to ventilate the patient. There's a lot of different schools of thought on it. Right now, they're trying to get you to ventilate to I think it's even one of your test questions, to an ETCO2 of 35. But most of you are not going to be able to measure that in the field of EMTs, endotracheal carbon dioxide release. So if you hyperventilate a patient, then it'll cause vasoconstriction, it'll decrease intracranial pressure. But also if you hyperventilate a patient, it'll cause vasoconstriction and it'll restrict blood flow to an already injured brain. So there's a real fine line in between how much ventilation is good and how much is bad.
I think what the test says is to start low with the titrate.
Right, but I think there's a question on there and the answer is 35, you can see it too. Yeah, 30 to 35 is where they want you in that range. I just don't understand that question because most EMTs and most BLS don't have that ability to measure that. Usually a color matrix, just put it on, it's like yellow or purple. 30 to 35. But same thing, but most of the EMTs, BLS is not gonna have that. You remember the Thanksgiving crash a couple years ago? The 200 string kids in the bomb cyclone?
Yes.
Yeah, we had both of them on vents, so we had to get to UC Davis in a bomb cyclone.
Yeah.
Trying to manage them at a ETC as we had 35, both of them at the same time. Going northbound and the southbound lanes. No, it did. We got them there. They both lived. Well, the snowplow, we had a snowplow CHP sergeant and then us. And the snowplow got us down to about Le Moyne and then it couldn't get through. There's too many cars piled up northbound that were stuck. So us, the CHP sergeant, just going in between cars all the way over to one shoulder, back through to the other shoulder. He used his push bumper, pushed a couple of them backwards, had to put it neutral, pushed them backwards and got through. 4 hours to get from that Shasta to Ruth. Then we met a critical care team from Davis Medicine Reading and took us the way to Sacramento. All right, any questions? Always bring Pat. Rest of that ALS doesn't apply to you. All right, we got a 14-year-old shot with a single gunshot wound to the chest. I actually had this in weed once. Entrance wound in the left anterior chest, just below the nipple line, no exit wound. That's not good. What are you thinking right there? Lung, heart, great vessels. 40 breaths a minute, heart rate's 160, capital refill times 40. Blood pressure is 50, systolic. Unresponsive. Pat says, I have all three of my findings are positive. What does that mean? Gonna run. They need to be in surgery like a few minutes ago. Any questions? Probably had a tension pneumo. It's going to decompress the chest. Yeah, look at that. No air movement on the left side of the chest. They got tension pneumo. So you guys could put an Asherman seal on it, occlusive dressing, with a vent, one side up, let it vent, might help. Or you could run for a paramedic or an ER that can decompress the chest. Any questions? Always communicate with the family and orient them to what you're doing. Never lie, never say it'll be okay. Any questions? Burns. Burns are more critical in children for the same amount of body surface area because they have a greater surface to mass ratio. Huh? Submersion injury. Kids drown. Happens. Be prepared. All right, I believe the last two CPRs in progress I did on pediatric were both drownings.
Right.
No, this brings us what?
I have a question.
Yes.
One of the quiz questions that had to do with drowning and the main reason links them due to alcohol.
Kids?
Adolescents.
It was, it says.
Oh, that's absolutely true in adolescence.
That confused me too.
Yeah.
Matter of fact, the last drowning we had here was directly tied to alcohol. St. Liskey. I don't Lake Siskiyou, not St. Liskey. Only drunk people call it St. Liskey. What? Nah, it was Anyway. It's embarrassing. All right, child abuse. As an EMT, you're going to be a mandated reporter and you have to know the flags. We're going to go over the flags with you right now. There are 2 million cases reported annually, and it's estimated for every case, there's 3 more cases that were not reported. See a lot of a lot of different signs and symptoms of child abuse flags. The one on the left there, that's blood distribution. That's when you put a baby's feet into like a boiling tub of water or oil. One on the right is various stages of healing. It's a great example. Yes, these are real pictures. Various stages of healing is a very common flag. It means that it wasn't just an accident that happened one time. It's been happening again and again and again. So you got fresh wounds, healing wounds, and almost healed wounds. It means that there's a pattern. Those are both flags. The things you want to ask yourself, is the injury typical for the child's developmental stage? This is actually one of the most common ones. I've had ones where it's a CPR in progress for a baby that wiggled out of the dad's arms and fell headfirst into the pavement. The baby was 3 weeks old. 3-week-olds don't wiggle. They don't have the muscle tone capability. It's physically impossible. Next one was a 10-month-old that ran into the hearth of a fireplace chasing her brother. 10-month-olds don't run. See what I'm saying? Is the injury consistent with the child's age and development stage? Is the reported method of injury consistent with the injuries? For another example, child has fallen on lava rocks and split his head open. You get there, they've got a clean incision with smooth edges across their forehead. Does lava rock cause clean incisions? No. Absolutely not. And then when pressed, the patient said actually his sister stabbed him in the head with a fork. Do forks make clean, long incisions? No. Yes, when law enforcement got to the said, we have the weapon, it was a butcher knife. I said, how'd you find it so fast? I said, it was the only clean utensil in the entire structure. Stabbed in the head with a butcher knife at the age of 4. Is the caregiver behaving appropriately? That's another one. They delay seeking care. For instance, mom's boyfriend knocks a teenage boy out unconscious. Mom drives boyfriend somewhere so he won't get arrested, then drives back and calls 911. Is that indicative of child abuse? Absolutely. Most people don't act that way. When their child's unconscious, they call 911 immediately. Make sense? Is there evidence of drinking or drug abuse? Usually. Any questions? These are all flags. Any one of these flags is a required CPS report. Delay seeking care for the child. Does the child have a good relationship with the caregiver? If you arrive on scene, the child goes to you for comfort instead of their caregiver. That's a huge flag. Like, thank God you're here. Multiple injuries at various stages of healing. Huge flag. Marks and bruises in unusual places. You know, kids fall down, get hurt. They do it all the time. They also do crazy, stupid things that are not child abuse. However, if they have bruises in places that even crazy, stupid things would cause in different stages of healing, that's obviously child abuse. Thing that you also have to remember is I should have started this part of the class of this is you have to remember you are not the one making an accusation of child abuse. You are not the one investigating it, and you are not the one that is prosecuting it. All you are doing is reporting the flag to the people that investigate and prosecute. That's all you're doing. Any questions? Do they have lots of different injuries? Burns on the hands or feet or glove distribution. And are they altered level of consciousness and no one knows why? That's also a huge one. Any questions? Yeah. Completely submerged in boiling water. Apparently that's some type of punishment that used to be done. It's still done. It's been passed down from generation to generation. Something like boxing years. Is the child clean at an appropriate weight? They have rectal or vaginal bleeding. Kids don't bleed from the rectum or the vagina. Not what I said, you misunderstood. I'm really tired and I didn't finish the sentence. What does the home look like? Is it clean or is it dirty? Is it warm or is it cold? And is there food in the house? How is this kid eating? How are they getting bathed? How are they getting taken care of? Any questions? You are required by law to report any flag. Does not matter if another agency is reporting it. Doesn't matter if the ER is reporting it. You are required to report it. You can't say, oh, fire department reported it, I don't have to. Or, oh, I'm sure they reported it at the ER. You are required to report it. Supposed to be the first responders report it, the transport agents reports it, and the ER is reported. Should be 3 different reports. Yes.
There's no problem if it's not actually true.
Yeah.
There's no problem.
They investigate it and there's nothing that turns to be unfounded, which most of the time it's found to be unfounded. Yeah, it's no harm, no foul. Any questions? Everybody has a form. Every agency has access to the form. It's right on the SSP website. If it's loaded. You can even fill it out online on your computer. Same when you do your PCR. Sexual abuse is way too common. There's no socioeconomic, race, or gender that has more or less sexual abuse than any other. Does that make sense? It happens at all socioeconomic levels. It happens at all genders and it happens at all races. Try to limit your examination of the kid. It's usually not a life-threatening injury that you would require exposure and life-threatening interventions. If at all possible, do not have them wash away any evidence or urinate or defecate. Be as professional as possible, emotionally supportive as possible for the child and family. And of course, transport to the appropriate facility that can collect the appropriate evidence with law enforcement. Any questions? Yes. Well, usually most hospitals have what they call SART equipment, or sexual assault response team equipment. And all of the, usually law enforcement and the nurses are trained in using it. We just got to make sure law enforcement's there so the evidence is collected correctly. So that way they don't get out of it in a court technicality. Any questions? You would be amazing what people can beat in court. Now, I'll give you an example. I had a kid out of Lake Siskiyou. I said not St. Louis, Lake Siskiyou. A 3-year-old whose dad was drunk in a canoe without a life jacket in April. Water was about 43 degrees. It's about 47 degrees outside. You can meet temperature. Drunk dad tips over the canoe. Kid goes into the water. Fortunately for dad and kid, there is a Forest Service engine that is doing training in the meadow on Lake Siskiyou and sees the whole thing goes down, gets them out of the water, gets the kid out of the water, strips excellent EMTs, strips the kid naked, dries him off with dry blankets and wraps him in a wool blanket, puts him in the cab of the engine with the heater on full blast. Couldn't do any better of a job. So we get there and dad refuses treatment for the kid, is going to drive him home. So we had to block dad's car with the ambulance and the fire engine until the sheriff's department got there. And the sheriff's department arrests him for drunk boating and child abuse, child negligence. He beats the child abuse in court because we didn't take a documented temperature before and after he went into the engine and got dried off. Yeah, seriously. And that there was no physical evidence of child abuse, despite the witness accounts of the engine and the paramedic. But they did get him for drunk boating, which is illegal. So you'd be amazed if you'll get beat in court, even with excellent documentation. Any questions? Child maltreatment. Don't understand, but here we go. We're going to go to the risk factors of child maltreatment, the assessment, and the legal responsibilities. All right, you're called to the home of a 2-year-old child. Parent states she's been crying since falling off a chair an hour ago. Parents insist the child be transported immediately and do not hold or comfort the child. Any flags there?
Yeah.
What is it? Yeah, and inappropriate actions of parents. That's not what parents do. And delayed onset. Yeah, who waits an hour? You got to get all the drugs out of the house. Seriously. Why else would you wait an hour? Pat says appearance is not good, but working breathing and circulation is normal. So we got a sick kid, but not a critically sick kid. Thank you. So what do we got there? Various stages of healing. Airways open and clear, respirations are good. Heart rate's 100. Capillary refill's a little slow though. Kid's alert. When you expose him, he's got multiple brown, yellow, and purple bruises in the trunk. So that signifies various stages of healing. Is that another flag? How many flags we got now? 3? Keep going to this call. We can start our own miniature golf course. All right, so we got 3 flags to transport the kid, and we notify CPS, write the report up with our 3 flags. That's a belt, I can tell you right now. That's a whooping with a belt. See the belt buckle. Any questions? 4 types of abuse are physical, emotional, sexual, and neglect. And again, it happens across every race and every socioeconomic status. Any questions? Yep. Any questions? There's some seriously evil people out there. Questions? Don't get bit. So things that mimic child abuse that aren't actually child abuse. Mongolian spots, those are basically like birthmarks. Cupping, which is what you see on the far left there. They're not what they're doing is they're taking a hot cup, they put it on there, supposedly takes the poison out. Whatever's making them sick. So it's really hard to define that as child abuse because it's not just what they call a mimic. Any questions? What's that?
Picture, is it pointing?
Yeah. Which also is not abuse, another cultural healing thing.
In more willing spots, you get natural.
Yeah. Yeah, it looks like a head bruise, but it's not, it's one of those spots. Go. Where did this bruise come from? They've always had it. Oh, sure. Risk factors, children under the age of 5 are at a higher risk for abuse than children over the age of 5. Children that do drugs and alcohol are at a higher risk. I'm just kidding. It's their parents that are drug and alcohol, caregivers, it's a higher risk. If there's a history of domestic violence, they're at higher risk. Any questions? It all makes sense. So always communicate with caregivers. Do not be confrontational. Do not be accusational. You'll make your flag reporting in the proper reports. If you feel you need law enforcement assistance, request law enforcement. They don't want you to transport the kid, it won't law enforcement, so you can transport the child or child safety. All right, who read the chapter already? What are your 4 duties? Child abuse. Suspect, protect, respect, collect. Any questions? Take the child to the emergency department, then mom discloses the dad's been abusing the child. Child's taken into protective custody. Any questions? All right, let's do another one. Call to an apartment where you find an 11-year-old caring for a 13-month-old boy with a fever. Any flags here?
Yeah.
It's the minimum wage, the wage is 12. So too young of a caregiver. That's a problem. I think I went backwards. All right, the babysitter sends you through a dirty room littered with beer cans. The child lying face up the crib whimpering. And she says, Mom didn't leave any bottles for the baby. Is it a flag?
Yeah.
Oh, yeah. Says, what are the important findings? So unsanitary conditions, lack of food, presence of alcohol, those are all separate flags. Sort of 4 now. What does Pat say? Appearance is not good, but work of breathing and circulation is. We got a sick kid, but not a critically sick kid. Thank you, Pat. All right, airways open, respirations are elevated, heart rates, okay. Blood pressures, okay. A little bit low. Yeah, quite a bit low. They're alert and they're very thin. They only weigh 6 kilograms, which is about 14 pounds. And their ribs are protruding. That's not good for a baby. And you also discover a cigarette burn on the child's finger. So that's another flag. So what do? We have 4 duties. Suspect, protect. There's our flags. Suspect, protect, respect, collect. So we transport the child, we don't have to involve law enforcement because there's only the 11-year-old there. We bring the 11-year-old with us, we commend her for calling 911. She's done nothing wrong. Document and communicate the findings and report it to Child Protective Services as you are mandated to do. Any questions? All right. We take the kid to the emergency department. diagnosed with failure to thrive. Turn the child over to Child Protective Services for nutrition. We get nutritional support and burn care, and it's going to go into foster placement. Any questions? Always be suspicious when you get inconsistent history, inappropriate child caregiver interactions, and the physical findings not explained by the history. Any questions? Always be an advocate for the child. You're required to report any flags. Doesn't matter the situation. All right, SIDS. We're seeing less and less SIDS. We used to see SIDS all the time. It's getting less and less with better education and better products. But known risk factors for SIDS is a mom that's a teenage mom, smoke during pregnancy, and a baby with low birth weight. Those are the three most common factors for kids that end up with SIDS, which is sudden infant deaths. And if they die, we don't know why. Any questions? So manage the patient, communicate with family members. They don't have postmortem changes, you call medical control, and you start CPR. If there's no, they're not rigged or decomposed. Any questions? Use the infant's name, communicate with the family, be non-judgmental. It's going to be a very stressful time. Will still be mandated to report because it's going to be a death. Any questions? Carefully inspect the environment, document it all because it could be evidence. Just because it's suspected SIDS doesn't mean that it is. I can tell you some pretty horrific stories, like crypts soaking wet, freezing cold. Things I have no idea what caused it. Just things are out of place that are not normal for what it should be. Family interaction, where the baby was at, what happened when you got there, the general condition of the home, the environment, what's going on outside. Any questions? All right, this is a big one. That apparently there's not a lot of education out in the field on. So especially if you're going to be on fire rescue, this is really important to know. ALTE, it used to be DRUE, now it's ALTE. This is when a baby is found blue and not breathing, and the mom screams and picks it up, and then the kid starts breathing in on their own. They don't know what causes this, but it's likely to happen again. A lot of times they'll call 911, they'll pick the baby up, the baby will blow in the face, the baby will start breathing again. Or they'll scream in the baby's face, the baby will go, start breathing again. The problem is that happens usually again. And there's nobody right there to see it, the baby dies. And too often first responders get there and mom goes, oh, it's okay, everything's right, just overreacted as the mother. They go, okay, sign here. And then cancel the ambulance and everybody goes home and the baby's dead 12 hours later. So these should never be AMA. You have to make base hospital contact and involve law enforcement. Any questions? Yes. Yeah, that's a little bit different. This is when the kid's found unresponsive. Yes. That's kids that literally hold their breath because they're just completely to the point where they don't know what else to do. All kids do that.
He's like the mom puts the kid down for now.
Yeah, and finds them not breathing or notices that they're blue when they check on them. Any questions? I also had an interesting thing today where I had a student that went through the EMT program, became an EMT, and I was giving a line of poop to some students in this class because they had not listened to lung sounds on the patient. And when I walked out, I had an EMT that had taken this class said, "Hey, I heard you say that to the student." I said, "Yeah." He said, "Well, I got to tell you, when I came to work here as an EMT, I got told, yeah, that's in Brian's class. We don't actually really do that in the field." And my response was, if you remember, we talk about my class, we're training you to be competent and to try to break the pattern of incompetence in the field. So when someone tells you something that's ridiculously incompetent, you probably shouldn't follow that lead. You should do lung sounds, you should do complete assessments, and you should know and follow your protocols. Any questions? Otherwise, you're never going to break that pattern. Death of a child. Do not speculate on the cause of death. Do not be judgmental. Be supportive. Report any positive findings to law enforcement. Any questions? Allow the family members to see the child and say goodbye. Make sure you don't disturb evidence. And if you need to, seek help for post-traumatic stress disorder if it was a highly traumatic, which most child deaths are for you and your team. Any questions? Kids with special needs. Over the last 25 years, the kids with special needs that are out in the field have skyrocketed. They used to go to institutions, but nowadays they're being taken care of at home. Better equipment, better educational parents, and lack of insurance has caused this. So kids that have not fully developed lungs that are on home ventilators, you will deal with. Kids that have congenital heart disease, you will deal with. Kids with neurological diseases and chronic dysfunction since birth, which there's endless ones, you will be dealing with. There's some of them tracheostomy too, because these are common. These kids go about and live a pretty normal daytime life. At nighttime, they get hooked up to a ventilator while they sleep. I've been on calls where kids at a regular public school out on the lawn playing with other kids and gets knocked down, and that's tracheostomy tube pop out. They instantly stop breathing. They're going to be dead long before any 911 units get there. Fortunately, a teacher's aide grabbed the tracheostomy tube, ran over to the drinking fountain, washed it off, went over, put it back in. The kids started breathing again. Got there, kids like, oh, I'm fine. She still went to the hospital. That was one of those, hell, you know, the helicopter's right there. CHP happened to be flying by. I was like, hey, could you guys land? Just in case we need you. There's a field right here. Nice to have a helicopter. Turned out we didn't give them some. Artificial ventilators. These are at homes all over the place now. They do malfunction. What do you do as an EMT if the ventilator malfunctions? Yeah, disconnect them and hook up the VVM. Do it the old-fashioned way. Any questions? Central IV lines, same thing. These are common sick kids that get to go home. They're getting lots of treatments, usually through IVs. Cancer patients, kids on long-term IVs. They're going to have central lines in place. I mean, they're consistently keep having to have peripheral lines restarted. Any questions? Gastrostomy tubes, a lot of your kids that have tracheostomies, or also have gastrostomy tubes, that's how they eat. And it's not uncommon for them to pull their gastrostomy tubes out or someone else pull them out by accident. You don't put them back in. Take them to the hospital, let the hospital put them back in. It's a pretty simple procedure. Any questions? Shunts, we're gonna go over this in a patient special needs for adults. But a shunt is when they put for kids with hydroencephalitis, if you don't treat it and drain constantly the fluid, their head grows because their fontanelles aren't fused, and they have these giant heads. Horribly tragic. But anyway, so what they do to treat that is they poke a hole in the base of the skull and they put it in a drain. It's drain called the shunt, and it runs down through the interstitial cellular stuff down to the abdomen and just drains in the peritoneum. The peritoneum expels it. But the shunt clogs or fails, they're going to get intracranial pressure, which can send their blood pressure to the roof and cause them to stroke and stop breathing. Any questions? It's the end. All right, who wants to go to break? Don't.
Is that loud, sir?
234 slides. We did it. All right. Group 1, sit right here. Group 2, right here. Group 3, right there. Group 4, right there.
Yeah.
Oh my gosh, we're playing Jeopardy. My I'm gonna let us down. Where's 3?
Right here, dude.
Oh, we're in our spot already?
Yeah, we're taking the spot.
Because we are team leader. You and me. We're the heart and soul of
We got
3.
All right. The sooner you guys get into teams and get started, the sooner you get to go to break.
Okay, guys. Trauma and legal, let's do that.
You pointed over.
Wait, airway.
No, this will be easier. We can change it. Group 1 in the front here, group 2 in the back corner, group 3 in the far back corner, group 4 over here.
Close enough.
Wait, we're
Sorry.
supposed to be over there.
It's
Yeah, it's supposed to
Nah.
squeeze me.
We can slide that way.
Team with the most points gets to go to break. This way this works. You have to raise your hand and yell your team number. And if I see you and hear you first, I will call on you. Start with team 1. Pick your category. You have to ask you have to ask it in the form of a question. That's how Jeopardy works. You don't give the answer, you ask the answer in the form of a question.
What is?
Exactly.
That's all the time. I got.
Group 1, what do you want?
What is the date?
It's probably around
500.
Airway for 100. Group 1.
Oh,
Oh, any of us?
Oh, yeah, we
Any
can.
of us?
Yeah, say raise your hand and say your group name. First one, your group number. That's epiglottis. 100 points. Group 1, still your board. All for 200. Group 2.
Yeah, just say it.
What is? What is level 1 trauma center?
Very good. Group 2 is now your board. You have to raise your hand and say your team number loudly.
EMS legal 500.
Wow, swinging for the fence.
Group 4.
Group 4. 4.
What is an advanced directive?
Boom.
Damn.
Group 4, it's your board.
They got the supers.
Trauma for 100.
Oh,
Group
I
4.
didn't say.
So what is the golden hour?
Group 4, your board.
We're back to- Yeah.
EMS legal 200.
EMS legal for 200.
Number 4.
Group 4.
What is the 4 things needed to prove negligence?
Very good.
Oh,
Your board, group 4.
she's just reading it off.
Trauma for 300.
It's 2.
There's 2. Let's get both.
No.
Well, yeah. I know it. It was negative.
Because the pulse is concerned throws me off.
Yeah.
10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Group 2.
Group 2.
Trauma system. What is trauma system? Okay, so it's a sucking chest when the pulse is extremity. You gotta ask the trauma system, right?
Based on
Red alert.
red box trauma. Very good. It goes, it's going to say anatomical, which is down red box trauma.
Wait, what?
Oh, yeah. Anatomical criteria for trauma activity. Holy shit.
All right, team 2, it's your board. Airway for how much?
Did one.
I think group 2 beat you. Go ahead, group 2.
What is concussive heart failure?
All right, so anybody else want to challenge that? Okay, say your name.
Team 1.
Yeah.
Cardio tamponade.
What is?
What is? Period.
What is a pericardial tamponade? All right, you're both wrong. There's unilateral breath sounds. That'd be a tension pneumothorax.
Oh.
Group 2,
Oh,
still your board.
I was thinking bilateral.
Wait, I see we're in third place right now.
Yeah.
We're ahead of team 1, so.
Still your board, group 2.
Pharmacology for 100.
Yeah, I'm out.
There's 4.
Group 4.
What is aspirin?
Very good.
You know, usually you're.
Group 4, it's your board.
Yeah, usually the guy running Jeopardy reads the question out loud.
Okay.
Trauma 4.
Problem 400. A 32-year-old male victim of a bar fight who has a laceration in the left external jugular vein. You have successfully controlled bleeding from the wound, and suddenly he experiences an acute onset of labor, breathing, and cyanosis.
Wait, you got to say it. Say real. I think it's there.
Group 2 or
Group 3.
Pulmonary embolism. What is a pulmonary embolism?
Does anybody want to challenge that? No? Group 3, I'm sorry, that's incorrect. What is an air embolism?
Oh, fuck. Damn.
You were close.
You were close.
Now we're really behind. It's okay.
Group 4. Problem for 500. bruise in the front, back of the brain from a deceleration injury.
Oh, we have that. We definitely have that.
That was
That was definitely.
Group 3.
That's okay, let them have it. Let them have it.
Three was first. It was
I
definitely.
heard 3 first.
Group 3.
Coup counter coup?
You
What-
guys
oh,
say
well.
the wrong
Yeah,
question.
screwed up, doesn't matter.
Group
Go for it.
2.
What is?
All right, group 2, it's your board.
No, we said it.
We said it way before you asked.
Your hands.
You have to
You have to ask it in the form of a question.
I'm very criticism.
Paradox of the mobility of the chest during exhalation.
Group 3,
Group 3.
what is a flail chest?
Very good.
Yes, sir.
Group 3, your board.
What do you want? Oh, A&P 500.
Oh, I did not say that.
Oh, I don't know.
Yeah.
Oh,
Team 3.
Oh.
Group 3.
What is the SA node?
Wow,
baby.
Oh.
Cinderella story.
Just go for another 500. Why not go
Group 3,
airway?
your board.
Go airway.
What, let's see, Airway 500.
The preferred standard air advantage of the tube inserted in the vocal cord.
Oh, team 3.
Yeah.
What is a oh my gosh, I'm blanking. What is an iGel?
No.
That is incorrect. Is there anyone else want to challenge that? Group 4.
Oh.
What does ET stand for? All right. Group 4 gets it.
What were you? Okay.
Yeah.
No, okay. Oh, I don't
Group 4, it's your board.
We're tied for last. And they have a super.
AMP for 100.
Group 2.
Group 2.
What is the central nervous system?
Very good. Group 2, your board. Dilated pupils, increased respiration, tachycardia, increased BP, anxiety, sweating, and dilated airways.
Group 3.
Group 3.
What is compensated shock?
No. I mean, yes, but no.
Oh.
Nobody else?
What is anaphylactic stop?
Well, that's wrong.
What are the same? Oh, sorry.
Group 4, you guys say your number.
Group 4.
Go.
What are the symptoms of compensated shock?
That's the same thing group 3 already had.
No, they say that's compensated.
It's
All right.
Yeah.
nobody else.
We're
What is fight or flight? A sympathomimetic response.
Oh.
I'm not going to take away points from group 3 because the sympathomimetic response is what compensated shock is.
Oh.
Team 2, it's still your board.
Yes. Pharmacology.
The CNS pressure that leads to rapid respiratory failure. Oh, for God's sakes, I should be eating people.
Yeah. No, it's
Group 2.
group 3.
Well, group 2 said it. Then go ahead, group 2.
Fentanyl? What is that? What is fentanyl?
Group 3.
Group 4, what did you have?
Group 3.
What is that, narcotic?
Group 3.
You guys were third. You gotta be first.
And the answer is.
Can we say it or not?
Actually, I'll give it back to group 2. It wasn't wrong. It wasn't the right answer.
Yes, what is an opioid?
Oh,
Oh.
anyway, sorry about that. It was. Okay.
Oh, it's narcotic. Okay.
Oh.
Group 4, your board.
I got it wrong.
You're close.
You must leave before.
Terminate patient care without terminating patient or someone else of equal higher level is what? Group 4.
Oh, yeah.
Group 4, you're bored. Soft membrane surrounded by the diamond shaped cartilage below the Adam's apple is group 2.
What is the correct correlation?
That is not correct. Anybody else?
Group 2.
Group 2 already answered. Nobody else? 5, 4, 3. You gotta say your name. Group 4.
What is cricothyroid?
That's also wrong. It's the cricothyroid membrane.
Oh, man.
Oh, that's dirty.
Group, it's not, there's a big difference between membranes and cartilage. All right, group 4, you're bored. Wait, someone walks away. AFB for 300. The valve between the right atrium and the right ventricle. Y'all need to know this, so we test questions. Team 1.
What is the trimester valve?
Very good, team 1. You're bored,
Guys,
team
we're gonna go
one.
negative.
Can't be
Already.
already.
Leave us legal for free.
That's enough for us to go pause.
Administer aspirin without contacting the hospital. What do you say your name?
3.
Team 3.
Offline protocols. What is offline protocols?
That'll work.
Yeah, I was gonna say
Standing order.
Good job, baby. Good job.
Team 3, it's your board.
We're on the board.
So are we going? Are we going?
No, we're not.
No, we're not special.
Pharmacology 300.
It's better to just take it.
Smooth muscle reactor that acts as a vasodilator.
That's fucking Team 3,
Team 3.
epinephrine.
What is epinephrine? No,
What is
they
it?
don't.
Just say it again.
They do.
You were wrong, Francis.
Oh, wait.
5,
Team
4, 3.
Yeah, team 3.
Team 3.
What? Very good. Team 2, you're bored.
We're negative again.
We almost
You're
did it.
single-handedly trying to keep us
What?
negative.
Hormone released by the cancers, which can be artificially administered to the patient.
Team 3.
That was
Team 3.
What is insulin?
Yes. Nice.
Team 3, you're bored.
Ready to go negative in pharmacology?
No.
Pharmacology 500.
Class of drugs that blocks the vagus nerve that controls the vegetative functions of the parent body, such as heart rate, respiratory rate, and digestion.
What is, or up Team 3?
Yeah,
What is a beta blocker?
sorry, that's not correct.
Oh, son of a bitch.
And we're negative.
I know, it sounded so right though.
I felt it in my soul.
Anybody else?
Ready to go negative? Hey, at least we're trying. I mean, nobody else is winning it, so.
Nobody?
Oh,
She answered.
The answer is, what is a parasympathetic blocker? The
oh.
parasympathetic nervous system.
It was something blocker.
I knew it was a.
Team 3, you're bored.
Oh.
Floating in front of me, and I couldn't remember exactly what the word was. I didn't know what the word
Release
was.
the hormones for fight or flight response.
Team 3.
Team 4,
What are the adrenal glands?
very good.
For sure, so.
Team 4, it's your board.
Oh my god, I keep calling you guys. Thank you.
Daisy double.
Group 4.
What is it?
Group 4, you can go to break.
Good job, Group 4.
No.
Teams 1, 2, and 3, you can go to break. Be back in 5 minutes after 8.
Sure, before you shoot 80, doesn't just gotta go to break?
Yeah.